Hi, my name is Larcy Cutright, and I am a health education specialist presenting on infant mortality in Louisiana. Women who have poor maternal weight and nutrition, smoke, live in poverty, and have elective early deliveries are at a higher risk of giving birth to an infant preterm, which results in higher rates of infant mortality in Louisiana. Since the preterm birth rate in Louisiana is the second highest in the nation, this presentation will primarily focus on preterm births, which have a high rate of resulting in infant mortality. Preterm births are births that occurred before 37 weeks gestation. They're usually caused by elective early induced deliveries, high-risk pregnancies, unintended pregnancies, lack and inadequate access to medical care. Smoking before and during pregnancy can cause issues with placenta, result in low birth weight or preterm birth, and sudden infant death syndrome. Sexually transmitted diseases that are contracted during or before and left untreated cause preterm birth. STDs can cause the amniotic sac, which holds the baby, to break early, resulting in preterm birth. Maternal nutritional status before and during pregnancy may contribute to the risk for preterm birth. Women with a low pregnancy body mass index are at an increased risk for preterm birth. Also, BMIs are higher among women who live in low or below the poverty line. The socio-ecological model is a great representation of the factors that impact the preterm birth rate at the individual, interpersonal, organizational, community, and policy levels. At the individual level, women who are healthy before and during pregnancy and have access to adequate health care are less likely to experience preterm birth and other complications. This includes not smoking, low rates for STDs, and a healthy body mass index. At the interpersonal level, physicians giving women progesterone injections who are prone to having high-risk pregnancies will reduce the preterm delivery. Physicians also discourage preterm elective births. At the organizational level, the Medicaid program in Louisiana reimburses doctors who choose to use a smoking pregnancy screening, which identifies whether the patient is a smoker. The state has a 1-800-QUIT NOW line that provides pregnant women with counseling on how to quit. Community level, the Louisiana Birthing Outcomes Initiative and Department of Health have asked hospitals to pledge to end the elective preterm births or inducing preterm labor unless it's medically necessary. A way that this could hinder at the community level is the Mothers Cultural Resistance to FISH's recommendations against elective preterm birth. At the policy level, the Louisiana Department of Health, Louisiana Medicaid Program, Blue Cross, and Blue Shield of Atlanta partnered together and announced a pay reform that will no longer pay or reimburse providers for elective preterm births. Currently, the Louisiana Medical Program has implemented coverage of weekly progesterone injections. Although 70% of the births in Louisiana occur to women who are Medicaid recipients, the implemented coverage of weekly progesterone injections will be pushed to other insurance companies to ensure that non-Medicaid users have the same opportunity. Since the preterm birth rate is substantially high in Louisiana, I'm proposing 3 interventions that will help reduce the infant mortality rate in Louisiana. First, I have the progesterone injection intervention. Then I have the medical delivery intervention and the preterm birth prevention clinics intervention. The progesterone injection intervention has a goal to reduce the preterm birth rate, just like all 3 of the other interventions. An additional goal of the progesterone injection intervention is to administer the progesterone injections weekly to all women that have a risk of high-risk pregnancies or the baseline data will be collected overall health and prenatal screening, medical histories of high-risk pregnancies, and other risks that contribute to preterm birth. The mothers will be given assessments and non-invasive medical tests will be performed if necessary. Post-innovation data will be collected by maternal and infant follow-up visits that monitor and follow the health of a baby and mother for up to 1 year postnatal. This mother will still receive educational counseling. For the medical delivery intervention, the goal is to discourage both the mothers and physicians against delivering preterm. This intervention is important because non-medically induced deliveries are often requested and then performed by the physicians. These physicians perform the elective preterm births, which contribute to the rates of infant mortality. To go further than discouraging non-medically indicated deliveries, physicians will no longer be authorized to perform elective preterm deliveries unless they are medically necessary. Medicaid and private insurance companies will no longer provide coverage for elective preterm deliveries. If requested, the mother will be informed of the risk of both her and the baby of being medically induced and will be told by the physician that they are no longer performed unless medically necessary. Also, the goal of this is that the private insurance companies do not pay or reimburse for coverage of this. The goal is to make this a non-authorized procedure. For the preterm birth prevention clinics, this will mainly focus on the mother receiving dedicated care and education of all risks that contribute to preterm birth, such as prenatal and postpartum care. These things are very important. They need to be education on sexually transmitted diseases, healthy eating habits, dietary supplements and vitamins, reproductive health, and previous high pregnancies and fertility treatments. This clinic will also screen women for high-risk pregnancies and unhealthy pregnant women. The baseline data will be collected using Louisiana's current maternal and child health surveillance systems, the Pregnancy Risk Assessment Monitoring System. Mothers will be given assessments to rate their current and maternal health care that they have received. Medical histories and current educational advertisements and interventions will be reviewed. The assessment will reveal a lack of resources in Louisiana's hospitals and OBGYN visits. And this information will be collected to revamp and reevaluate and implement new programs that will be supportive of preventing preterm births. Okay. There are important aspects to consider in ensuring a successful evaluation of the progesterone injection intervention, medical delivery intervention, and preterm birth clinics intervention. The success will be measured based upon the following things. For the progesterone injection intervention, the success will be measured for women that have a high-risk pregnancies that they do not deliver preterm due to the weekly injections. Insurance companies are required to provide coverage of progesterone injections for women with high risk. This is to ensure that everyone has the same opportunity to receive these injections. For the medical delivery intervention, physicians are no longer authorized to perform elective preterm births, and insurance companies are to cease coverage of elective preterm deliveries unless they are medically necessary. Preterm birth prevention clinics, to measure their success, it will be based on the revision and creation of preterm prevention clinics, knowledgeable mothers with high-risk pregnancies, and increase in prenatal and postnatal care. For this particular intervention, it is to assure that the mother is in good health during and before the pregnancy and the health status of the infant. The development of funding and proper education of risk and compliant physicians are really important. There are potential challenges and solutions that these interventions will face. Many of the challenges are funding, compliance with target population, and compliance with physicians and insurance companies. The proposed solutions for these are increased collaborations with community partnerships, adequate education of risk, adequate training of risk, and reevaluation of intervention resources. The logic model shows a representation of evidence-based interventions, inputs, activities, outputs, and outcomes and impact. The overall impact of the interventions is to reduce the preterm births in Louisiana. I would like to thank you for listening to my presentation.